medical school. He went on to do an internship and a residency in pediatrics. He did a fellowship in infectious disease, had his own practice in Escondido, California for 15 years and worked emergency room at the same time. And then in 1997 started to specialize in alternative medicine. He's also an Ironman triathlete. He's completed 38 Ironman distance triathlons, and this summer is going to be doing 2 more. So he definitely lives the lifestyle.
Can you speak louder?
He lives the life. Did you need to repeat any of that?
No, but
okay.
It's really hard to hear.
He definitely lives the lifestyle that he talks about, and I just want to remind you that there's a special offer tonight for a reduction on cost to have an appointment with Dr. Minkoff, and you'll see Tamara if you're interested in doing that later. Tamara's in the back. And also, Nature's Food Patch is very gracious to have us come here, and they very much like your input and what you feel about tonight's lecture. So please sign this, fill it out before you leave. And then some of the gals in the back have clipboards. Dr. Minkoff writes actually 4 newsletters a month, and if you want to subscribe to any of them, they're free. You just sign up with the girls as you leave. So again, thank you for coming in. Here's Dr. Minkoff.
Hi. How many of you have ever had ozone therapy? If you work for me, don't raise your hand. How many have ever heard of it before? Hi. Good. Probably up until a few years ago, it was very uncommon, and it really wasn't something that you could get. Is that working?
No.
That you could find very many places. Can you hear me in the back? Switch it all the way over. How about now? Okay. Good. All right. So what's the one thing that you can't live without? Oxygen. Oxygen, right. And what happens if you don't get enough oxygen? You die, right? But if you don't get quite enough oxygen, you die, but you die, it might take a little longer. Okay? We know that lack of oxygen is involved in premature aging, in cardiovascular disease. It's the reason people get cancer, because a cancer cell is basically a cell that can't get enough oxygen and has to adapt so that it can still live. And in that process, changes a whole lot of things that turns it into a cancer. So oxygen as a therapy is used all over the place in medicine. You go to the hospital and your blood oxygen level is low, and you get an oxygen mask or you get oxygen prongs. And it's well known that this is a helpful thing. But it isn't well known that if you can get oxygen in the body in the form of ozone, that it helps virtually everything. Now, oxygen exists in the atmosphere, and about 20% of the air that we breathe is oxygen. And oxygen isn't stable as a single molecule. It's always virtually bound together, so it's O2. Now, if you take O2 and you add some electricity to it, you can get O3. And O3 is ozone. The smell that you smell after a very nice rain is ozone that gets produced in the process of that. There's ozone in the atmosphere. You probably heard that there's an ozone layer as a hole in it over Australia, and so the sun rays are very too intense. Ozone is used in air fresheners and air purifiers. It's used in swimming pools and water purification. And it's used that way because it has a lot of properties which can be adapted to a lot of things. So what we've found is that a lot of times people, what they're suffering from is not enough oxygen, and so they age. And one of the main things that happen is that the mitochondria are the things inside cells which make energy. They take a molecule of glucose and a molecule of oxygen, and they make energy, which we call ATP. And if there is oxygen and sugar, the mitochondria will make 36 of these ATPs every time one of these things gets processed. And the ATP is like money, it's like fuel. So if your scalp is going to grow hair, it needs ATP. If your liver is going to detoxify, it needs ATP. If your heart's going to beat and your arms are going to move, they need ATP. And if you don't have enough ATP, then the things that require it don't work. It might be slow thinking, it might be depression, it might be can't sleep, it might be leg cramps, it might be fibromyalgia pain, but it's not enough ATP in that area so that that thing can do what it does. And when the body gets injured, these mitochondria don't function. So it could be lead or arsenic or mercury or pesticides or chemicals that poison the mitochondria so that you don't get ATP. Or if there's not enough oxygen coming out, you're going in, you don't get enough ATP. But also, if you don't have enough oxygen, the mitochondria get damaged and then they can't make ATP. And so you get a vicious cycle. Something injures this, and then even when it's injured, it can't do this, and then these things start to die. And so a healthy cell might have 3,000 or 4,000 of these inside of it, and a cell that's not very healthy might have 1,000 inside of it. It's only a quarter as many, the energy doesn't get produced, and so the system doesn't go.
Is there a way of measuring that?
No. I mean, in a biopsy you could see it because you could blow it up with a great big microscope and you could count them. So if you take a biopsy of someone who's got fibromyalgia, of the area where it really hurts, what you'll see is not enough mitochondria. You'll see that those cells are anaerobic. They're not making oxygen. There's a bit, and so if you do this without oxygen, if you make energy, this cell's only going to make 2 ATP for every sugar molecule. And that's called anaerobic, not oxygen. And the mitochondria aren't used. They don't work. And in this process, you get acid. You get lactic acid. And so the experience of lactic acid is if you hold you hold one hand around your wrist and then pump it about 50 times, you'll start to get an achy pain, cramps, spasms in your hand. Why? No oxygen. It ran out, it can't make more ATP. It's going to start making lactic acid. The lactic acid builds up in the tissue. It then causes the thing to hurt, to not function as well. And all these areas in people where this occurs that's what's going on. You get lots of acid, you get not enough ATP, that further damages the mitochondria, and so that's the vicious cycle that you somehow have to get somebody out. Yeah?
How do you determine if your mitochondria are deficient due to heavy metals versus just a lack of oxygen?
Well, that's the game. That's what we do. That's what we try to figure out. So a person comes in with a complaint of, I don't have any energy, or I can't sleep, or I don't feel well, or I'm getting sick all the time, or whatever it is, I'm constipated. It doesn't really matter. It's this system is impaired. So we go down the list. Okay? And the list, basically, there's 2 categories on the list. 2 big causes. something isn't there enough. You have a deficiency. You don't have enough vitamin D, or you don't have enough selenium, or you don't have enough amino acids, or you don't have enough essential fats. You have a deficiency. And if the mitochondria doesn't have those things, its structure can't be made up, and so it just won't work right. Or you have too much of something that shouldn't be there. You're poison. So, deficient, poison. So I see somebody and I say, what's wrong with you is two things, both are going on at the same time. Your body's missing something that it needs, and we have to find out what. Maybe quite a few things. And you have things in your body that shouldn't be there, and they're poisoning your mitochondria, they're poisoning your cells. And if we can get these things out and these things in, you will get better. And we've gotten really good at this, because there's a pretty good, we got a good list, you know? Most of this stuff is either being your poison because of what you've got inside of you. You got funguses or parasites or root canal teeth or mercury in your teeth, where the poison's in you. And it gets released, and then it goes to all these cells, and then they poison you and make you sick. You know, that I saw somebody yesterday, and she was telling me about a restaurant and the pesticides in the restaurant. And they got something happened, and there were some bugs walking around, and they got reported, and so they have to pesticide everything. And she says, is it okay to go in there after the pesticide guy goes in there? And I said, it's really not okay. The way the bugs die is that the pesticide poisons their nervous system. Well, it poisons our nervous system too. It isn't safe. There are safe kinds of things that will kill bugs, like baking soda. But the regular stuff that's used really isn't safe. And so a little bit won't kill you. But a little bit, you know, if a guy here in an apartment building, or your lawn guy comes and they spray this stuff all over the place, and you get exposed, and so you walk barefoot on it and you smell it, and you get it every day, little more, little more, little more, little more. And then you don't have enough vitamin D, you're a little low in amino acids, and your boss is stressing the heck out of you, and you've also got fillings, and you took a couple Tylenol because you had a headache, and then you went to the gas station and you filled up with gas and you breathed the gas fumes, and then you heated up your soup in a styrofoam cup in the microwave. And if you count the number of exposures of poisons and pesticides and chemicals and toxins that we get every day, it's in the thousands for everybody, no matter how careful you are. And they add up. So if you eat organic food and you filter your water and you do all these things, it's good. It's good. But you can count the number of things that you get. It's just where we live in a sea of polluted sea. And so, if we can get the level, there's a bucket. There's a bucket, and the body can handle it as long as the bucket, you know, there's a valve on the bottom which is detox. So your liver and your lung and your kidney are able to move things out at a certain rate, if they're not too poisoned and they're not too deficient. And what happens at a certain point is this gets slowed to a trickle, and the numb stuff coming in is too high, and your threshold gets too much, and then you get sick. You get a heart attack, you get cancer, you get a stroke, you get diabetes, you pick your disease. You get fibromyalgia, you get depression, you get psychosis. It's all the same. You know, add infection in here. So, you know, viruses and funguses and parasites, they all contribute to the load. It's the total load. And when the load exceeds your body's ability to handle it, then you don't feel well and you get sick. And the way to unload the load is this got to get opened up. And this got to stop. So first rule of toxicology is stop the poison coming in. You know, get your bad teeth out, get your mercury out, start eating organic food. Lower your load. You know, watch your cosmetics, watch your body care products. Because most of this stuff is full of chemicals and poisons. Okay? Now, ozone plays a role in this because ozone will rehabilitate a sick mitochondria. It will wake it up and it will get it to function. And so that's really important. It will also kill viruses and funguses and parasites and bacteria. It will also flood oxygen into areas where there isn't enough oxygen. It makes blood circulate better. It will cause a cholesterol plaque to reduce in size. So there's all these amazing benefits for it. It will cause cartilage to regenerate.
Really?
Yes. And it will cause chronic areas of pain to get better, to reduce. So we can use the ozone in a lot of different ways in a lot of different places. My son's wife's mother, in-law, I guess that's what you call it, in-law. She's had chronic cystitis for, I don't know, 15 years. Now, chronic cystitis means that your bladder is inflamed and it hurts all the time. And when any urine comes in your bladder, you have to urinate because it irritates you. So you have to run to the bathroom all the time. You have chronic pain here. It's very difficult. There's even a chronic cystitis national society group. There's a pharmaceutical company that sponsors it. I mean, it's not like there's just a few people with it. There's a lot of people with it. And the solutions for it aren't very good. So she was suffering from this. And we said, well, let's put some ozone in your bladder and see if that will help whatever it is that's going on, the chronic inflammation that's going on. And I think she had 3 or 4 treatments where we put a catheter in her bladder, we put some ozone in the bladder, and in 2 weeks her bladder pain was gone, she could wear tight jeans again, and she's a happy camper. I've seen hundreds, if not thousands, of patients since about hundreds at this point with ozone, where if you inject ozone into a tender, painful joint, a shoulder, a neck, a back, it may take 4 or 5 treatments, a knee, an ankle, that the area regenerates. The cartilage starts to regenerate, the inflammation goes down. Probably in a lot of these cases there has been a very low-grade infection going on in that joint. And the bugs die and the joint feels better. And the pain goes away. And I'm probably seeing, I don't know, 5 or 6 or 7 people every day now that come in with joint pain. We inject the ozone into the area. They come back in 2, 3, or 4 weeks. And usually within 2 to 5 treatments, their pain is either way better or it goes away. Yes?
Say you have like a whole spine that has like an inflammatory arthritis, something going on. Would you do the IV in that case? Or
Well,
would it need
yeah. Now, depending on what the condition is, the ozone can also be given intravenously. And so the way we do that, it's called major autohemotherapy. Major auto means self-therapy, hemo means blood. So we put an IV in somebody, we drain out about a cup of blood, we add the ozone, it's like you're donating blood. We add the ozone to the blood in the bag and mix it up. Now when you take out blood like that, it's venous blood. It's blood from a vein. It's dark. There's a low oxygen level and the blood looks dark. When you put the ozone into the bag, the ozone oxygenates the blood, so the blood turns bright red, just brilliant light bright red. And then we hang the bag up and then run the blood back in. Now the ozone reacts with the blood in the bag. And what it does is it really kicks up the antioxidant and the detoxification enzymes in the body in addition to oxygenating the body. And so the person, and it starts the mitochondria healing process. And usually within 5 or 6 treatments, the person notices a difference. Now, when we bring something new in the office, I experiment on myself first. So when we brought this in, I was interested in, would it improve my exercise? Would it improve my ability to exercise, and could I go faster? Could I go longer? So before I did it, I did a test on myself, and I got on a stationary bike, and I have a stationary bike where I can measure my heart rate at the same time that I measure how much power my legs are generating. It's measured in watts. Okay? And I got on the bike, and I was pedaling to generate 200 watts. For a person my size, that's a little over 20 miles an hour on a bicycle. And my heart rate at that amount of effort was about 155 to 158. As long as I'm below 162, I can keep going at that rate. So that was a good test for me about what I could do. I did 10 ozone treatments. I did 2 a week for 5 weeks. Didn't change anything else. And I redid the test. So I went up to 200 watts again, and before my heart rate had been 155 to 158, after the 10 ozone treatments, it was 138. There was a huge difference. I thought I had a flat tire. In fact, I stopped the test in the middle to reach back to feel it was a back tire flat, because if the tire's flat, the resistance on the little thing that measures it is low. Same amount of time. And I found that I could do about 230 watts at this heart rate. So I had about a 15% increase in power performance, which is a huge amount. For an athlete, it's a huge amount. At no cost except 10 ozone treatments.
How would you administer it?
Well, I did that intraoral chemotherapy. I drained my blood out, I added the ozone, hung the bag up, ran it back in. It takes about a half an hour. If I plug it in, the blood's out in 15 minutes, and then when it hangs up, it runs back in about 15 minutes. If you have a small vein, it may take a little bit longer. So it produces a real change. With people who have chronic viral infections, like chronic hepatitis C or chronic Epstein-Barr, this kicks up your immune system. One of the treatments for those is something called interferon. Ozone kicks up interferon. So we find that after a number of treatments, sometimes if a person has been sick for a long time, it might be 15 or 20 treatments. But they start to oh man, my cells are getting oxygen. My mitochondria are starting to work. I'm starting to feel better. My viral load is going down. Okay? So it can make a big difference. Your question? In someone who's a chronic illness, we start with a lesser amount. We don't really see too many with a real healing crisis. If I see someone who's ill, I start them low. Usually we start with 100 cc's of blood and 100 cc's of, I said a cup, but when we start with like 100 cc's. So you take 100 cc's of blood, 100 cc's of ozone, next time 150, 200, we go up to 250. If I see somebody who's like, ooh, I gotta be careful with them, I might start with 25 or 50 cc's. See how they do. And then if they do okay, boost them up. And so usually, I've never had anybody get really sick. We've done hundreds of them. I had one person call me on the weekend and they were like, ooh, is this okay? She wasn't in a crisis, but she didn't feel very well. She was a person that had hepatitis C for a long time. But after about the 16th treatment, she looked like a new person. She just really made a difference. Yeah.
Would this help with the likes of breast cancer or diabetes?
Well, in all the cancer patients, we use it. They'll get 2 or 3 treatments a week. Sometimes we use local ozone on the cancer, where you inject ozone into the area where the cancer is. People with diabetes should do this treatment because the problem with diabetes is what? What's the problem with diabetes? Well, it's circulation. You get premature artery disease with diabetes. And so they get artery disease. You know, their feet go numb, the nerves get killed, their kidneys go bad, and this makes blood flow, and it delivers oxygen. So in a lot of times we combine this with chelation, because virtually everybody has a huge load of heavy metals. I've never done a heavy metal challenge on anyone and gotten a negative test. Never. There's always arsenic and mercury and lead and cadmium and everybody walking around because we're all exposed to it. So if you combine the ozone with the chelation, call it kezo. So we do the ozone first and then do a chelation treatment. You really improve circulation, because the chelation makes circulation much better. It makes blood flow better. Ozone doesn't really chelate heavy metals, no. Ozone helps with the detoxification process, so that your own liver and your kidney will do it better, but it doesn't really chelate by itself. The other thing we've had very good results on is with cardiovascular disease. You know, people with bad circulation in their legs, or bad circulation in their brains, or bad circulations in their heart, is the ozone is very helpful for them, because it really does improve circulation. And then there's a whole group of people who have trouble with their eyes. They have macular degeneration. And we've had really extraordinary results with macular degeneration, where people's vision gets better, and they go to the eye doctor and they come back and they say, gee, you know, they mapped my retina and I got a 30% better area, and my macular degeneration is drying up. It's getting better. So it has just a lot of uses in a lot of different places. I have a patient now who's got rheumatoid arthritis, like bad. He's probably 6'4", maybe 6'3", and he's been probably 10 years searching. He's been everywhere, trying to find some solution, because his wrists are like this, and his knees are like that, and his ankles are like that, and he came in and he's kind of walking like this. He couldn't sit down to go to the bathroom. He goes to the bathroom number 2 like that, because he can't get down. He's been here with us for about 4 months, I think. Okay. Now he's gained about 25 pounds of weight, which he couldn't do before. And his wife had to do a double take last week because she walked by the toilet and he was sitting on the toilet. And then I did a double take because I saw him in the parking lot on his motorcycle, and he couldn't do this because his wrists were like this. And he's riding his motorcycle, and he's walking without a limp. And his ankle size and his knee size have greatly reduced. And he's getting ozone in his blood, and I'm injecting ozone in his joints. And the joints respond. They go down. They start to heal. The inflammation goes down. It's amazing. It's amazing to see it. Yeah.
How does ozone effectiveness compare to like PRP type injection?
Well, I do it with PRP.
What is PRP?
So PRP stands for platelet-rich plasma. If you take somebody's blood and you draw a tube of blood and you put it on a centrifuge, so you spin it, then the heaviest things go to the end, and then the lightest things go to the top. And when you do that, the red blood cells go to the bottom. They're the heaviest. And the white blood cells and the platelets are the things that help blood clot. They go in the middle. And then you get the serum, you get the liquid part of the blood on top. And that middle layer where the platelets are, it's called the Buffy coat, where the white blood cells and platelets are, is very rich they act like stem cells. They're full of growth factors that turn on things. And so if you inject that into a joint or an area where you need something to grow, for the tissue to get turned on to grow, those growth factors will turn it on. And if you add ozone to it, it works even better. So we would inject the growth factors first, and then inject the ozone afterwards on top of it. And you get a much better. It's better. It works better. Yeah.
When you talk about all these success stories for people's joints, are you doing both procedures on them mostly? Or are you doing mostly 100% ozone without the PRP?
I start with ozone because, yeah. So on a joint, she asked me, do I start with PRP or do I start with ozone? And what I do is I'll usually do 3 ozone treatments first because almost everybody responds just to ozone. And then if they don't respond, like number 4, I'll say we're going to do PRP now. I'm going to get your blood and do that, and then we'll do the ozone with it. But it's probably 1 in 20. Usually the ozone's enough. Yeah.
What about PSA? Of course, I'm not speaking about myself, but it runs high, but it's been determined not to be cancer, but it's stuff that's,
Well, there's an inflamed prostate for whatever reason.
Yeah.
We do the ozone rectally.
Do you? Okay.
Actually, quite a lot of it. Now the prostate is right there. It's just inside the rectum, and for colitis, for chronic diarrheas, for Crohn's disease, the rectal ozone, it's almost like magic.
What about like diverticulitis?
Well, diverticulitis too.
Okay.
Okay? So, and for anybody with prostate disease, I would do that. And on these prostates that are sort of swollen and boggy and they're inflamed, the other thing that's very helpful for them is a pulse magnetic field treatment. We have it's a machine that generates a pulsed magnetic field. And that magnetic field will milk fluid from an area where it's not supposed to be. Like if there's a swollen hand, like an accident or a big swollen thing, and you do pulse magnetic field, the fluid gets pumped out of it. And the cells that are there, that are suffering from mitochondrial problems, it recharges the battery of the cell. And so for a lot of those guys, their PSA is 6, 5, there's no cancer, they sit on that thing 3 times a week for a month, their PSA goes down, now they're not getting up 5 times a night to pee. And they might need a maintenance treatment once every couple of weeks. Usually works really well. Plus some supplements to make sure that they're getting enough, nutrition to the prostate. Usually that works fine.
Don't you worry about the process, possibly some cancer cells that hadn't been picked up getting loose in the system that way?
Through what?
Through this pulse magnetic thing? Is it pulling
No.
out? No, it's not. That's not.
No, we use it on cancers.
Okay.
It improves the blood flow, it improves the immune system.
Okay.
All the cancer patients get the pulse magnetic field treatment over the area of cancer. So I did bladder, I did bowel. Here's the other one we do, ears. You can put ozone in your ears if you want to clear out your sinuses and get your thinking sort of turned on. Everybody a little bit different, but I had somebody today that I saw. She says, I love the ear ozone. I love it. She says, I'm sitting there, I got the ear ozone, and it's like 10 minutes. We take a stethoscope and we blow ozone through the stethoscope and it goes into the ears. And she said, I was sitting in your IV room and I could clearly hear a conversation from someone who was about outside the room in the hallway. Felt like I was not even in my body and I could hear remotely. Anyway, she's jumping the story. So do you know what an adaptogen is? An adaptogen is something that you take that if it's too low, it raises it up. And if it's too high, it lowers it down. So it's adapt, it's changed to meet the circumstance. Ozone is the ultimate adaptogen. You put it in a body just about anywhere. I've had lipomas. A lady came in with a great big lipoma on her back. Like a golf ball sized lipoma, like a fatty tumor in her back. And she said, the dermatologist said I have to have surgery and I don't want the scar back there. So I said, let's put some ozone in there and see what happens. So, put the ozone in there, the darn thing shrunk down. I did wrists are numb, my hands hurt at night. You want to tell them?
Yes, mine were totally numb and rock hard, especially when I was sleeping at night. And it would wake me up every single night. So I walked into Dr. Minkoff's office and I said, please, you have to help me. I have carpal tunnel, it's keeping me up at night. I have a torn meniscus in my left knee, which other doctors told me that in order to fix the torn meniscus, I would have to have a meniscectomy, which is remove the entire meniscus. That's how bad it is. I said, I have a sciatic nerve and I have lower back pain. So I said, can you help me? So I've been going to him now for 3 months, and we've been putting ozone in the areas that's needed, and I'm sleeping at night. I have no pain whatsoever, and I want to go back to that doctor that told me about the meniscus problem and just like laugh in his face, because he swore to me that I will not, and I told him I'm going to go to this doctor because I discovered him online, and I'm going to go try this ozone therapy, and he laughed at me. Now I want to go back and laugh at him because he's, oh my God, I told my husband he's my idol. He's over it now.
But he's a good cook.
Yeah.
They have a very nice restaurant. So if you want really good Greek food, talk to them.
We want a restaurant impossible. So.
Anyway, the carpal tunnel, one injection on one side, the pain was completely gone. I mean, it's you know, compared to what people go through with surgery and that sort of stuff, it's, you know, if this doesn't work, there's no downside to the ozone. You know, there's no real side effect. You know, except you get an injection and it costs some money. But there's no sort of, it's very safe. There's no deaths associated with ozone therapy. There's thousands of published papers on ozone therapy. Almost all of it's been done in Europe and Cuba, because there's been very little of it done here in the United States. There's no deaths reported from ozone therapy. So it's very, very safe. And it's a natural substance, you know, it's oxygen. It's something the body's used to and knows it. And so it's very safe. Well, the companies manufacture machines that change oxygen. So you take 100% oxygen and you run it through this machine, and what comes out is, instead of O2, it comes out as O3. So when a patient needs the O3, I just go there and I pull it up in this, I turn on the oxygen, I pull it up in a syringe, and I walk in the room, and then we put it wherever it has to go. See if I missed anything. Well, for diabetic neuropathy, there's a nutritional component to it, and there's a circulation component to it. And as part of the nutritional component, oxygen would be one of the things. As part of the circulation part of it, ozone would also help because it helps circulation. So it's both.
Okay, what about somebody with a very low platelet count, like 25?
Well, usually someone with a low platelet count, there's a reason for it. You know, I go back to here. They're toxic. They're deficient. Ozone isn't a direct cure for anything. It's not a direct cure for really anything. But as part of the program, depending on what's wrong with someone, it adds in a dimension that is very good. Yeah.
Allergies as far as addressing allergies?
It would probably be, again, part of the program. Most people with allergies, virtually every person with allergies, has a gut problem. You know, they got a leaky gut. And they got an overactive, inflamed immune system. And so that's got to get corrected. Now, as part of their program, I would say, hey, we should do a couple of ozone treatments a week too. That's just part of it. It will help you. But as a cure or a single treatment for allergy, I don't think it would be enough. Yeah.
Breast cancer.
Well, for breast cancer, like I said, we do a lot of cancer treatment in our clinic, and every cancer patient gets ozone. They get ozone. Sometimes they get ozone IV. Sometimes they get it IV and rectally. Sometimes they get it also, you know, in an area where the tumor is. So it's a very important part.
Are they still taking chemotherapy?
They might be taking chemotherapy at the same time. It doesn't interfere. And there's nothing, if you're doing this, you can't do that. It's really very flexible.
How about bone spurs?
Well, like a symptom of bone spurs in some cases would be like someone with like plantar fasciitis, where they walk around and they got a spur on their heel and they got a chronic pain. And they go to the podiatrist and they inject some cortisone in there, and sometimes they'll work, sometimes it doesn't. I've had a 100% success rate with plantar fasciitis with injecting ozone into the area of plantar fascia. It's just like, I haven't had anybody fail.
You had any experience with vertigo related to damage or?
I have a guy, it's not so much vertigo, but it's chronic tinnitus, where the ears are just ringing. It's like vertigo. Where the ear ozone was helpful. I would try the ear ozone. About what?
Hernias.
Hernias, probably you need the surgery. Some people may get a result if it's not very big with using something injected locally where it will cause a scar formation. The other thing ozone works very well on is varicose veins. That you can inject the veins with the ozone and the veins will squeeze down and go away. Yeah. What about cost? I'm going to have you talk to Tamara. When I talk about cost, I get in trouble. All right. Any other questions?
When you take insurance.
We don't take insurance. Insurance won't pay for this. Yes?
You have to use a vein, or can it be put back in a port?
I worry a little bit about the port because ozone will corrode plastic. So generally on the ozone, we do a vein.
Dr. Minkoff, have you discussed the difference between the results between the injectional procedure and the IV procedure?
There's two ways of delivering ozone. One is the way I described to you, which is the major autoimmunotherapy, where you take blood out, you add it to the blood, and then you run the blood back. The other way of giving ozone is that you can give the ozone direct intravenously as a push. And I reserve that for the patients that are very sick, because it's stronger, and you get a more pronounced effect. So the guy I was telling you about who had rheumatoid arthritis, he did probably 20 or 25 ozones and was getting better. A few weeks ago, we started to give him the ozone direct intravenous push. He's had just an accelerated improvement with it. So we have some people doing that. Generally, we start people on the other one.
Is this the most successful treatment you've seen for rheumatoid arthritis?
Well, it's one of the things that added to almost anything makes it better. You know, especially for pain, especially for cardiovascular disease, for chronic viral infections. You know, this stuff is really, it's really helpful, and it's really safe. You know, it's really safe. So we're always trying to get the most effect without causing a downside or a long-term problem. I mean, the trouble with regular sort of pharmaceutical medicine is, yes, it did get the infection under control for those 5 days or 7 days. But now you've got a gut to deal with, and you've got all the other stuff that's going to be like, oh no. And in this one, I haven't experienced any kind of, oh no, I wish we hadn't done it. So that's the kind of medicine that's ideal, and that's very helpful. And it's rare. There is now an American Academy of Ozone Therapy, and there's a certification process. So you take the course and you take a test and you send in 10 cases to prove that you can do it, and you get a certification. certification for it that you're licensed, the license that you can do ozone therapy.
You have to be an MD?
Depends on the state you're in. Some naturopaths can do it, and some states chiropractors can do it. It just depends on the state. In Florida, it's a DO or an MD. And I think there's only 140 guys in the whole United States. So there's not much. Now I spoke this year at the International Association of Ozone Therapy because I've had a lot of cases and a lot of experience with it, and I had a lot of just amazing results. And so at that meeting there was probably 300 people. A lot of the best work is being done in Cuba on this, and especially in Germany and in Italy. The textbooks are written by Italians.
Is there any combination with that oxygen therapy? Hyperbaric oxygen?
Well, hyperbaric oxygen is another way to deliver oxygen. It's a valid treatment, and in some cases you might do both. In some cases, one or the other might be enough.
Has there been any studies in doing that? I mean, do they do it? Have they done that in Europe? I've gone through hyperbaric oxygen post-cancer, oral cancer, and I had to have teeth extractions done post all of it 2 times. The first time was about a year after the initial onslaught of the cancer with the radiation. And 20 treatments then, everyone saw healing because you're 100% oxygen for 2.5 hours times 40 treatments. But I'm wondering if that's a combo that they would put that into the chamber while you're there.
Well, you can't breathe ozone. It's too irritating.
So they would have to be.
You can put it almost anywhere, but you can't breathe.
Oh, really?
It's too irritating. If you've got one of those ozone machines in your house and you turn it up too high, you get sort of dry cough and irritation. You can't put it in that way.
So you can't, no inhalation, unlike the.
No inhalation. The other thing is I forgot, and one of our staff's husband is a carpenter, and he was daydreaming, or I don't know exactly what happened. The piece of wood slipped, something occurred, and he tried to cut off the tips of 2 fingers. And he went to the emergency room, and they told him there was a 98% chance he was going to lose the tips of his fingers. Oh, there he is.
My fingers, man.
Anyway, so he's got so we did ozone. He got ozone IV, and then every day we put a plastic bag around his fingers. Blew the ozone in the bag so he could get ozone on the wound. And he's got 2 fingers. I mean, they told him that the fingers were going to have to get chopped off because they're too far gone. And he's got 2 good fingers. So if you want to look at his fingers, so for wound care and that kind of thing, it's really good. It's really good. All right.
Do you work with the miracle powder for things like the fingers?
Miracle powder? No.
Yeah, the one that, no, it's from the interstitial cells, they take from like pigs, and you put it on an open wound, they literally regrown bones, as well as the nail and everything.
You'll have to tell me about it.
Okay.
No, the training is done. The guy who's been sort of trying to get this going for 20 years is a guy named Frank Schallenberger. Some of you may get his newsletter. It's called Real Cures. He's the head of the American Academy of Ozone Therapy. He has a training course for physicians. He's the guy that I recommend. He's the pioneer.
Doctor, you mentioned in passing these air purifiers that always have these ozone controls.
Yes.
And I've gagged myself when it got turned up.
Yeah.
Should that just never be on?
No, I think if you run it at a level that's comfortable, like the one I have, say, if the room size is this size, you can have it at this level. But don't turn it up to this level. Don't put a 1,500 square foot amount of ozone being dumped in that room if you have a 250 square foot room because it'll be too high and it'll be irritating.
I see.
So generally people sense it, and then that's too much. So I think they're good, but
So once you smell it or rasp your throat or something.
well, it's too much.
It's way too much.
Yeah.
So you shouldn't detect it.
Right. The other thing is ozone. You can ozonate olive oil or different kinds of oils, and it's topical. So sometimes we use it on dental stuff. if you've got pockets or you've got stuff going on with your gums, topical ozone is very effective because it works like an antibiotic, but it doesn't, these bugs don't get resistant to it. So that's another method. Wounds, things like that can be helpful. Yes, last.
My husband was being treated for pneumonia for 6 months with the wrong antibiotics. They finally took a sputum sample and found they were giving him penicillin for Klebsiella, which is resistant. And then we found out through a person that we were getting relation with that they ran a fungal test and he had aspergillus. And apparently 300,000 to 400,000 people a year die from COPD, which they say nobody knows what it is, just from aspergillus infection.
Right.
We had black mold from a roof leak 20 years ago.
Right.
And I've had it in my sinuses, and the ozone will completely wipe it out. So anybody with COPD, go see you.
That's true. Okay, good. So I just got to shut it off. So I hope this was interesting for you. If you have questions, if you want more information, Tamara's our office manager. She's in the back. There's a couple of other staff here if you have questions. And I'll stay here if any